Established in the year 1953 as the Ceylon Obstetrics and Gynaecological Association, the Sri Lanka College of Obstetricians and Gynaecologists is one of the oldest professional bodies in the country with a proud history of service excellence. The inaugural meeting was held on the 19th of November 1953, where Dr. Mrs. May Ratnayaka became the first president, and the first patron of the college was much respected academic, surgeon and senator Sir Nicholas Artigala. After 15 years, in 1967, a new professional body was formed under the name of Association of Obstetricians and Gynaecologists. Professor D.A. Ranasinghe was elected as president, while Sir Artigala remained as the patron. In conjunction with this, an editorial committee was appointed with Dr. Siva Sinnathambi as the editor. As a result of this, the first journal was published in 1969. In May 1970, the Association of Obstetricians and Gynaecologists was awarded the college status, thus became Ceylon College of Obstetricians and Gynaecologists, CCOG. And with the introduction of the Republic Constitution in 1972, it became the Sri Lanka College of Obstetricians and Gynaecologists, SLCOG, which prevails prestigiously to this date. Under the wise guidance of many presidents, the SLCOG continued its journey of success continuously, carrying out its scientific programs and other activities. Dr. Siva Sinnathambi became the first woman president of the SLCOG in 1983 and was largely responsible for elevating the status of the college to an international level. Her period of office was of historic significance, with the 10th Asia and Oceania Federation of Obstetrics and Gynecology conference being held in Colombo in 1985 for the first time. The original headquarters of the SLCOG was in a room at the residence of the late President Dr. Siva Sinnathambi at Colombo 7. In January 1988, the college office was shifted to a room at the Sri Lanka Medical Association at Vijayarama Mawatha, Colombo 7. At present, the SLCOG headquarters is located in the beautifully constructed SLCOG House in Model Farm Road, Colombo 8. The SLCOG House was officially declared open by Professor Sir Sabaratnam Arulkumaran in 2008. The SLCOG House has its own auditorium named after Samson Rajapaksa, which can accommodate over 170 people. A new addition to SLCOG headquarters is a simulation center for the training of doctors and health staff. It was completed in 2016 with all the modern facilities. The Postgraduate Institute of Medicine, PGIM, of the University of Colombo was established in 1980 for postgraduate training. A board of study in obstetrics and gynecology was formed around the same time to provide guidelines for training in the respective field. The SLCOG has continued to collaborate with this board since then. The SLCOG works in unison with the PGIM in conducting Part 1 and Part 2 MS examinations in obstetrics and gynecology, with tremendous contribution by members of the SLCOG. A diploma course in reproductive medicine is also conducted by the PGIM, in which the SLCOG members function as lecturers, trainers and examiners. SLCOG promotes training of subspecialties in gyne-oncosurgery and subfertility, and trained consultants in respective fields have been posted to Cancer Institution Maharagama, teaching hospitals Kandy and Gaul. In addition, SLCOG plays a leading role in educating other healthcare personnel involved in maternity care through Safe Motherhood Program, the SHO, training programs and workshops. SLCOG and its members have been committed and actively contribute to bringing down maternal deaths in the country. Direct obstetric courses have become low in the casualty list, whereas medical courses such as heart disease, respiratory disease have contributed to most of the maternal deaths in recent past. Members who are working in peripheral hospitals provide 24-hour specialist cover, even with minimal facilities in most places. The SLCOG has taken a leading role in bringing down the deaths due to unsafe abortion, bleeding and pregnancy-induced hypertension by conducting training programs with the support of the Ministry of Health. SLCOG is actively involved in maternal deaths reviews and is committed to support the Family Health Bureau to strengthen the present maternal death audit system. FIGO has been a beacon that has helped globalize our college and thereby enabling nations to share their common interest in the field. The post-placental IUD and the post-abortion care are two projects that the SLCOG is involved in a big way with the collaboration with FIGO. The bond between AFOC and SLCOG dates back to 1967, where Dr. Siva Sinnathambi became the second vice president from 1987 to 89. Later, she was elected president for her immense contributions. The 10th AFOG Congress in 1985 and many other workshops on maternal perinatal health have been conducted in Sri Lanka over the years. The bond between the college and RCOG has gone from strength to strength since 1953, nurturing and growing all together. RCOG has contributed greatly towards postgraduate training of our postgraduate doctors since 1972. MRCOG Part 1 preparatory course and examination was started in 2015-16 in Sri Lanka, which benefited trainees from Southeast Asia as well. An MOU was signed between SLCOG and RCOG in October 2012 to strengthen knowledge and clinical skill development among postgraduates and consultants. A landmark event in 1995 was the establishment of the South Asian Federation of Obstetrics and Gynaecology, SAFOG. Originally, the idea was suggested by Dr. Rohan Pereira, and the SLCOG took the very first step in convening a meeting in Colombo on 7 September 1995 under the then President Dr. Lakshman Fernando, with the participation of delegates from India, Pakistan and Sri Lanka. The third SAFOG Congress was hosted by Sri Lanka in 2001, which was an immensely successful event with the election of Dr. Lakshman Fernando as the new president of SAFOG. The 8th SAFOG scientific session was held in April 2011 in Colombo, and Professor Harshalal Seneviratne was inducted as the president of SAFOG for the period 2011-13. The college has proved its ability and commitment to maintaining cordial relations with the Ministry of Health and non-governmental organizations to improve women's health in the country. SLCOG extends its support to the Ministry of Health by its participation, producing and implementing guidelines and setting standards. Nominated college members participate in the advisory committee meetings held by the Ministry and Family Health Bureau. The Safe Motherhood program has been conducted by the SLCOG for over 25 years, with the inaugural program being held in Anuradhapura in 1991. This program targets the education of doctors, nurses involved in maternity care, field midwives, and the general public. In 2012, it reached a pinnacle where 6 parallel programs were conducted with security personnel and government officers who look after the welfare of people being included. The tsunami in 2004 destroyed the lives and homes of thousands of people, as well as many of the hospitals in the coastal areas of Sri Lanka. Members of the SLCOG formed a team and visited most of these areas and organized facilities countrywide, where conducting antenatal clinics and organizing emergency facilities for patient admissions and deliveries with the assistance of the government. During the final phase of the war, internally displaced people were treated at Chendikulam Hospital after converting it into a specialist care center. A team specialist from SLCOG provided excellent maternity care for IDPs from the north and east. The Ladies Forum was formed in 2011 to ensure participation of all the families at events held by the SLCOG, enhancing racial, religious and cultural harmony among members and their families of the SLCOG. SLCOG, with the Association of the Ladies Forum, carry out a few activities annually: Avrudhotsavaya, Members' Day, Bhakti Ghee Program, Christmas carols, and Buddhist, Hindu, Catholic and Islamic religious programs have been organized from time to time. SLCOG, the legacy